Hi, everyone. Steve Adubato. We kick off the program talking about the world of healthcare with one of the top healthcare leaders in the state of New Jersey. Deborah Visconi is president and chief executive officer of Bergen Newbridge Medical Center, one of our partners in the world of healthcare. Deb, good to see you first.
Good to see you too, Stephen. Thanks for having me on. It's always a pleasure.
I was saying right before we got on the air, not that anything big is happening in the world of healthcare. We're taping on the 18th of March. Number one challenge you and your colleagues in the world of hospitals and healthcare face today is?
Funding and financing.
Oh, that money, huh?
Money.
Let me ask you this. How challenging is it to lead at Bergen Newbridge with so much uncertainty around us?
So, we're used to uncertainty in the world of healthcare. So it is always a challenge, but challenges present opportunities. And so, the key for us here and as leaders in the healthcare space is to make sure that we're always engaging with our stakeholders, with our communities, with our employees, with our patients, to make sure that we continue to be a beacon of health, hope, and healing for those that we serve. So the ability to lead through change and opportunity, is extraordinary, especially these days where, there's threats to our basic funding sources. So keeping an eye on the focus, which is to provide extraordinary health care for our communities, is paramount, and to, put some of the noise behind us while we continue to engage and embrace the reason why we're here and fulfill our mission.
Let me ask you this, Deb. We're doing a series called Tomorrow's Physicians. The graphic will come up, looking at the physician shortage and also the pipeline, if you will, for future physicians, medical school, cost of medical school, et cetera, et cetera. Talk to us about this physician situation in 2025 for you and your colleagues.
Yeah, it's definitely a challenge. There is extraordinary shortages throughout the country in specific specialties, but across every physician type, there's shortages. We have been doing a lot of innovative things, really looking at the pipeline, partnering with medical schools, fellowships, identifying, those that are graduating so we can give them opportunities at our medical center. We have tremendous partnerships. We're a clinical affiliate of Rutgers, New Jersey Medical School. So that partnership does help us recruit providers and doctors to our medical center. We are looking for loan forgiveness programs, implementing those kinds of things. We're looking at, the way of life workforce, flexible scheduling, implementing telemedicine, telehealth platforms, leveraging our allied health professionals like nurse practitioners and physician's assistants, giving our physicians what they need to be successful and to want to come work with us, whether it's technology, new EMRs, other types of technology that will help make their lives easier and better for them so they can provide that hands-on care.
The whole question of the aging population, people are living longer. And some might say, well, that's great. People are living longer. But healthcare, medical needs become obviously much greater as people get older. How is Bergen Newbridge dealing with the aging population in and around the community you serve?
So, we have a very large nursing home here on our grounds. We have over 400 residents that live here in our long-term care facility. So we are very in tune and recognize the growing needs of our aging population. And we're committed to providing that comprehensive, accessible, high-quality care for the older adults. You mentioned it, but over 17% of Bergen County's population is 65 years or older. And I'm sure you know this too, by 2030, all the baby boomers will have reached the age of 65. So operating one of the largest nursing homes in the state, we serve thousands of low-income and vulnerable seniors, many of whom are dependent on Medicare and Medicaid for their care. And what we're doing is making strategic investments, like we have an assisted living that's part of our extended care programs. We're about to open a PACE program, the program for all-inclusive care for the elderly, on site right here at Bergen Newbridge, which is a program that offers coordinated, comprehensive healthcare services, allowing seniors to age in place safely while receiving the medical, social, and rehabilitative support that they need.
the question of trust or distrust in the public health, I don't like saying infrastructure. I don't know that it's not, we're not building roads. The public health universe, your world, the level of distrust, the question about, and the graphic will come up, vaccines, what you need to know. It's a public awareness initiative we're doing. You've been involved in this healthcare community for a few years. What is the most important message you would like to share to folks about vaccines, safety, and trusting the system?
So, as a steward of public health and healthcare in our communities, I would tell our communities that vaccines and really public health are critical in protecting our communities. Vaccines are one of the most effective tools in preventing serious illnesses, hospitalizations, and deaths from infectious diseases. We strongly support vaccination efforts, not just for COVID and flu, but all
No.
other preventable diseases.
Measles.
Measles.
How the heck did this ever become something other than a public health issue, Deb?
I think there's, we talk a lot now, and which is a good thing. We talk a lot about vaccines and their efficacy, and there's a lot more awareness in our communities, which I look at as a good thing.
It is a good thing.
The more educated we are, the better decisions we can make. So I think, especially with COVID, the advent of COVID and the COVID vaccines and those conversations that we had for the last several years, I think our communities are becoming more engaged and more informed about the right thing to do. And so I think that has really led to a lot of the conversation around vaccines.
Yeah, when you join us next time, because this is a moving target, as I said, we're taping late in March. Next time you join us, give us an update on where we are in terms of Medicaid, Medicare cuts, because we don't know where they are right now. And taping a program today that airs later is risky in that regard. So come back in a few months when it's clearer where we are and give us an update. Deb Visconi, I want to thank you so much for joining us. We appreciate it.
Thank you for having me.
Thank you. That's Deb Visconi, President and Chief Executive Officer, Bergen New Bridge Medical Center. Thank you, Deb. All the best.
Thank you, Steve. Take care.
You got it. Stay with us. We'll be right back.
Public service. It's what we do. At the PSEG Foundation, through volunteer hours, partnerships, and our other contributions, we're committed to empowering communities. We work hand in hand with you, our neighbors, to educate young people, support research, environmental sustainability, and equitable opportunities, provide training and other services all over New Jersey and Long Island. Uplifting communities, that's what drives us, the PSEG Foundation.
Also brought to you by Horizon Blue Cross Blue Shield of New Jersey, Community Food Bank of New Jersey, EJI Excellence in Medicine Awards, a New Jersey Health Foundation program. NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. The New Jersey Education Association, PSEG Foundation, Lincoln Tech, the New Jersey Economic Development Authority, and by NJ Best, New Jersey's 529 College Savings Plan.